A very good evening to everyone. I am Kirti Dyal, your host for today, and I'm pleased to have you here with us for this webinar hosted by the SCRMP Pharmacy Wing, West Bengal Chapter. The topic for today's webinar is Emerging Opportunities and Emerging Skills in the Modern Pharmacy Sector. Before we dive into the session, let me take a moment to introduce you to the organization behind this initiative. Founded in 2024 and based in Telangana, India, the Society of Clinical Research and Medical Professionals is dedicated to empowering healthcare professionals and advancing clinical researchers. With a focus on innovation, collaboration, and education, SCRMP supports the growth of life sciences and clinical research, driving a meaningful impact on global scale. We offer a variety of membership options designed to support students, researchers, and professionals at every stage of their careers. These memberships come with exclusive access to educational resources, networking opportunities, and events like today's lecture series. As a lifetime member, you will enjoy several valuable benefits, including internships in pharmacovigilance and medical writing, through our collaboration with Novo Evidence, as well as free manuscript publication in our journal. Joining SCRMP is an excellent step towards enhancing your professional journey while building valuable industrial connections. Now, I am honored to welcome Dr. Krishna Undela, a leading expert in pharmacy practice, as the speaker for today's webinar. Dr. Undela completed his M.Pharm from 𝙗𝙗𝙗𝙝𝙗 Mohali and PhD from JSS Academy of Higher Education and Research, Mysuru. He began his professional journey at the JSS College of Pharmacy, Mysuru, and is currently serving as an assistant professor at 𝙗𝙗𝙗𝙗 Guwahati, where he teaches the subjects like clinical pharmacy, pharmacoepidemiology, and pharmacoeconomics. His primary research areas include medication therapy management in chronic diseases, pharmacovigilance data mining, evidence synthesis, and health economics and outcome researches. Dr. Undela has received international recognition, including the Endeavour Executive Fellowship in 2015 from the Australian government and travel grants from ISPE and ISPOR to present his work globally. With over 110 publications, 1500 plus citations, and an H index of 19, he is a highly respected researcher in his field. He has delivered more than 190 lectures at national and international platforms. Dr. Undela also holds key positions such as coordinator of the International Society of Pharmacovigilance South Asian Chapter and serves on multiple international committees, contributing actively to the advancement of pharmacovigilance and pharmacoepidemiology. With that, I'd now like to invite Dr. Krishna Undela to begin today's session. Over to you, sir.
Thank you, Kitty. Thank you for that kind introduction. I'm very glad for that. And first of all, I'd like to thank the organizers. It's a very good, I think, platform they created for this kind of webinars. And special thanks to Aditya, who has contacted me for this lecture series. And I'm very happy to accept because I know that most of the participants are the enthusiastic and the future pharmacists who are studying currently or maybe passed out recently from various pharmacy colleges. And the topic given to me to speak on today is going to be like emerging opportunities and emerging skills we require in this modern pharmacy era. And I thought like when the modern comes, because all other pharmacy courses, people are well aware, like diploma in pharmacy, bachelor's in pharmacy, masters in pharmacy, PhD and all, and they have their respective roles and responsibilities. And I feel that whenever we say something modern pharmacy, especially the Indian perspective, the PharmD is something new to us, and not many people are aware about PharmD and their roles and responsibilities, especially because they are not dealing currently with the patients, basically, like as a clinical pharmacist. So I thought maybe I can bring some idea about like, it is also important that from which institute you are coming out. It is not that simply you studied PharmD somewhere, in some college, where there are no facilities, there are no faculty, no exposure, no skills, no knowledge, nothing. In those cases, obviously, you will be deprived of job opportunity. Okay. It is certainly important that from where you have completed your PharmD, how much knowledge and skills you have gained. Very, very important, because it is not that simply someone will call you and give you the job. They will obviously see your knowledge and skills. Based on that only, you are going to be recruited. Okay. If the recruitment need to be happen, first of all, you need to acquire the skills for that recruitment. Then you are suitable. Okay. So now I can quickly take you like where exactly a PharmD student can fit in. They can go for it. Like they can obviously work as a clinical community pharmacist. They can have their own pharmacy shop and start dispensing medications, providing counseling. Like whatever the clinical pharmacy services I mentioned, it is not that you should do all those things only in the hospital. You can perform certainly even in the community pharmacy. Okay. If a pharmacist really sitting in a community pharmacy, if they start providing their services well, people are going to recognize. Why people are not recognizing pharmacy profession nowadays is going to be like main this reason, where we don't see any pharmacists sitting in pharmacy dispensing medications. Okay. So we are spoiling basically our own profession. That's what is happening. You can certainly be a hospital pharmacist. You are well qualified for that. You can start go on dispensing medications in the hospital setup, in the hospital pharmacy. And main job role is going to be like clinical pharmacist. As I told you, like you can do much better, not only restricting yourself in a community and then hospital only for dispensing medications. You can certainly do better now as a healthcare professional, not like a simple dispensing pharmacist. You can be a healthcare professional along with a doctor and nurse. You can be working in the hospital, in the ward, in the department, in the setup where the patient will be treated, and you can start providing all the clinical pharmacy services to the patients, right? We can call them as a clinical pharmacist. So this is going to be like basically how the pharmacist can practice. And the pharmacy student is eligible for all the three positions where the pharmacist can practice. Okay. That's what is called as pharmacy practice, basically. And the pharmacist, whenever he's practicing the pharmacy, we can call it as a pharmacy practice. Community pharmacist, hospital pharmacist, and clinical pharmacist. And then you can go to the industry as well. In the industry, you are welcome for the manufacturing, but you may be overqualified sometimes, because manufacturing, they will be offering mainly for B pharmacy students. If you're really interested for manufacturing, you can certainly go there, because in a PharmD course, in the first 4 years, you will be taught the pharmaceutics well, similar like B pharmacy. So you're also having all the understanding related to the manufacturing and the company setup and all those things. So you are well suited for going for the manufacturing domain in a pharmaceutical industry if you're interested. And then main chunk is going to the CRO companies, clinical research organizations, where these are all called as a third-party organizations. Like Novartis, Dr. Reddy's and all, they may be the core companies. They are inventing the medications. For doing the studies and all, they may not be having such a manpower. So what they can do is like, they will be depending upon the third-party companies. We can call them as a clinical research organizations. So they will give all the responsibility to the CROs to conduct all the studies for their medication and give the result to them. See the opportunities and grab the opportunities. So these are the things we need to do it. And finally, with Dr. APJ Abdul Kalam ji quote, like without your involvement, you cannot succeed. With your involvement, you cannot fail, right? So involvement from our side is certainly important. More than like PCI government, we need to be involved more. We need to, wherever the profession you are going, you need to showcase, first of all, you are a pharma student, showcase yourself, like how much you can do. Then certainly the opportunities will come. They will follow you. You don't need to follow the opportunities. Opportunities will follow you if you start showcasing yourself, if you start involving in the activities what you're performing. Okay. So with that, I'll complete my presentation. Maybe we can spend more time now if you have any discussion points or any questions, or if you want to add any of the points than what I mentioned here, because you may be aware a few more things. Let us open for the discussion now. Thank you.
Thank you, sir, for this enlightening and highly informative session. We'll now open the floor for questions. Please feel free to ask anything related to today's discussion. You are allowed to turn on your mics while you ask the question, but other than that, it is requested to all the participants that while sir will be answering the questions, your mics must be switched off. So can we start
Sir,
with the
what about
first question?
R&D department? R&D department.
Okay. Yeah, R&D department, you can work, but at present, R&D department, they're mainly taking the PhD students. Like if you want to really working in an R&D department, I feel that better after PharmD, you can complete PhD and then go for R&D. Because what happens like in PharmD, you are not trained more in research, basically. You are more trained in the practice. You are not trained more in the research. Because before going to industry in R&D, we need to have some skills. So for getting that skills, I suggest you can spend some more time, like especially if you go to any good university, do PhD. Anyway, while doing PhD, you're getting the stipend that is more than your salary. You're gaining that, and after completing PhD, you can go to industry to work in R&D department. So for R&D, PharmD alone may not be sufficient at present. And that's what my feeling basically.
Sir, pharmaceutics.
Strengthen our image for job applications. Specifically, what kind of soft skills do PharmD students need to differentiate themselves from the other candidates?
It's a great question. Like, you completed PharmD in which year, with which percentage and all, everyone will be having that. And percentage usually not a matter for the company. They don't even look after that. Okay. But main thing is like what extra you mentioned apart from PharmD. Okay. While doing PharmD, I did all these things, even including your extracurricular things also fine for them. At least you did some leadership role. You have organized one entire event as an organizer or as a manager or maybe as a team. Mention all these things. At least they will see all these skills apart from your curriculum things. They want to see all these things in your CV, because when you join in a company, it is not that you are individually working in a company. You need to work with a team. So they will understand at least you are a good person to work with a team when you mention all these skills in the CV. In addition to that, some parts maybe you can mention like the project what you did in the 5th year, and maybe the internships, in which departments you completed the internship. Okay, what are the departments you completed your rotations? And main thing is going to be like the other things, like what are the softwares you learn during this period. At least minimum thing, MS Office, like how to prepare a proper Word document on any content. How to prepare a best PPT. Okay. And nowadays, I think you should be knowing even how to handle that ChatGPT and other AI platforms. Must be knowing. Okay. We need to use
clear communication have been truly inspiring, sir, and your contribution today is deeply appreciated. I am confident that this session has offered essential insights and guidance to our audience. I also want to thank our amazing audience for their engagement, enthusiasm, and thoughtful questions throughout the session. And lastly, I would like to congratulate the event. And once again, thank you, Dr. Undela, for this exceptional presentation and session.
Thank you. Thank you very much, Kirti. I'm very much honored, very happy that all the students together organizing this kind of events for other students. Basically, it's a great initiative from your end, and I must appreciate the Society of Clinical Research and Medical Professionals. I can see bright young students here. I'm very happy to see all of you. Okay, so work for future and work for others. And if you need any support from my end, I'm there in the LinkedIn. You can contact me anytime. I'll try to extend my support maximum possible. Okay. And you did a wonderful job, Kirti. You organized everything very nicely as a host. And so may I know like where you are studying now currently?
So I am from ISF College of Pharmacy, Moga, Punjab.
Great. I can see that, the quality. Thank you.
Thank you, sir. We are highly grateful on behalf of our whole team. I am highly grateful for you, and we hope that we collaborate with you in the future. And thank you for this motivation. We deeply need it. Thank you so much.
So thank you very much.
Have a great evening, sir.
I want to see all of you in a great heights in future for pharmacy. Okay. And remember me, like if I ask you any request in future. Thank you.
Definitely, sir. Definitely. Thank you.
Bye.